How did the coronavirus emerge and spread? How did scientists develop vaccines and treatments in record time? How did the pandemic affect our health, society, and environment? And what can we do to prevent or prepare for future outbreaks? These are some of the questions that we will try to answer in this episode, based on recent studies and articles. Hello and welcome to Curiosity, where we explore fascinating and interesting topics about everything. Today, we are going to talk about what did we learn from COVID-19, the disease that has changed the world in the past year and a half. Let's start with the origin of the coronavirus. The virus that causes COVID-19 is called SARS-CoV-2, and it belongs to a family of viruses that can infect humans and animals. The first cases of COVID-19 were reported in Wuhan, China, in December 2019, but the exact source of the virus is still unknown. Some evidence suggests that it may have jumped from bats to humans through an intermediate animal host, such as a pangolin or a mink. However, other hypotheses, such as a laboratory leak or a natural spillover event, have not been ruled out yet. According to the World Health Organization, a team of international experts conducted a joint study with Chinese scientists in early 2021 to investigate the origin of the virus, but their report was inconclusive and faced criticism from some countries. The WHO has called for further studies to trace the origin of the virus and understand how it evolved and adapted to humans. One of the most remarkable features of SARS-CoV-2 is its ability to mutate and generate new variants. Variants are versions of the virus that have accumulated changes in their genetic code over time. Some of these changes may affect how the virus behaves, such as how easily it spreads, how severe it is, or how well it responds to vaccines or treatments. Scientists use genomic sequencing to monitor the emergence and spread of variants around the world. Some of the most concerning variants are alpha, beta, gamma, and delta, which have been detected in more than 100 countries and have been associated with increased transmissibility or reduced vaccine efficacy. To combat these variants, scientists are working on developing booster shots or new vaccines that can provide broader protection against multiple strains of the virus. Another major achievement of science during the pandemic was the development of safe and effective vaccines against COVID-19 in record time. Before COVID-19, the fastest vaccine ever developed was for mumps, which took 4 years. But thanks to advances in technology, collaboration among researchers, and unprecedented funding and support from governments and organizations, several COVID-19 vaccines were authorized for emergency use within a year after the pandemic began. Some of these vaccines use novel platforms, such as mRNA or viral vectors, which can be produced faster and more easily than traditional vaccines. As of August 2021, more than 4 billion doses of COVID-19 vaccines have been administered worldwide, according to Our World in Data. However, there is still a huge gap in vaccine access and distribution between high-income and low-income countries, which poses a threat to global health security and equity. The WHO has launched COVAX, a global initiative to ensure fair and equitable access to COVID-19 vaccines for all countries. Besides vaccines, scientists have also been searching for effective treatments for COVID-19. One of the most widely used drugs for treating COVID-19 is dexamethasone, a cheap and common steroid that can reduce inflammation and prevent death in severely ill patients who need oxygen or ventilation. Another promising drug is remdesivir, an antiviral that can block the replication of the virus and shorten the recovery time in hospitalized patients. However, remdesivir is expensive and has limited availability in some countries. Other drugs that have been tested for COVID-19 include monoclonal antibodies, which are synthetic proteins that can bind to the virus and neutralize it. Ivermectin, an antiparasitic that has shown some antiviral activity in laboratory studies but has not been proven to be effective or safe in clinical trials. And hydroxychloroquine, an anti-malarial that was initially touted as a miracle cure but was later found to be ineffective and potentially harmful for COVID-19 patients. Apart from developing vaccines and treatments, scientists have also been trying to understand how COVID-19 affects our health in different ways. One of the most puzzling aspects of COVID-19 is its wide range of symptoms and outcomes. Some people may have no symptoms at all, while others may have mild symptoms such as fever, cough, or loss of taste or smell, or severe symptoms such as difficulty breathing, chest pain, or organ failure that require hospitalization or intensive care. Some people may recover quickly, while others may experience long-term effects of the infection, such as fatigue, brain fog, or heart problems. This condition is known as long COVID or post-COVID syndrome, and it can affect anyone, regardless of age or severity of illness. Scientists are still investigating the causes and mechanisms of long COVID, as well as the best ways to diagnose and treat it. Another important aspect of COVID-19 is how it affects different groups of people differently. For example, older people, men, and people with underlying health conditions such as diabetes, obesity, or cardiovascular disease are more likely to develop severe COVID-19 or die from it. However, these are not the only factors that influence the risk and outcome of COVID-19. Social and economic factors, such as income, education, occupation, housing, and access to health care, also play a significant role in determining who gets infected, who gets tested, who gets treated, and who survives. A study by Gonzalo Mina and his colleagues in Santiago, Chile, showed that COVID-19 death rates were greater in low-income areas than in high-income areas, especially among people under age 80. This was due to factors such as crowded households, lack of health care, and inability to work from home. The study also found that lockdowns and mobility restrictions had a greater impact on reducing transmission in high-income areas than in low-income areas. The pandemic has not only affected our physical health, but also our mental health. According to a survey by the World Health Organization, the pandemic has disrupted or halted critical mental health services in 93% of countries worldwide. The survey also revealed that many people have experienced increased stress, anxiety, depression, or substance abuse due to the pandemic. Some of the factors that contribute to poor mental health during the pandemic include fear of infection or death, social isolation or loneliness, loss of income or livelihood, grief or trauma, stigma or discrimination, and uncertainty or misinformation. To cope with these challenges, the WHO recommends that people seek professional help if needed. Maintain a healthy lifestyle. Stay connected with family and friends. Limit exposure to news and social media. And practice positive coping strategies, such as relaxation techniques, hobbies, or volunteering. The pandemic has also had a profound impact on our society and economy. It has disrupted education for more than 1 billion students, increased poverty and inequality, reduced trade and tourism, threatened food security and nutrition, exacerbated gender-based violence and discrimination, and hampered the delivery of essential services and humanitarian aid. The pandemic has also exposed the weaknesses and gaps in our health systems and social protection systems. To address these issues, the United Nations has launched a global response plan to support countries in tackling the immediate health emergency, protecting people from the social and economic consequences, and recovering better by building more resilient and inclusive societies. The UN has also called for global solidarity and cooperation to ensure that no one is left behind in the fight against COVID-19. The pandemic has not only affected humans, but also animals and the environment. Some animals have been infected with SARS-CoV-2 by humans or other animals, such as cats, dogs, minks, lions, tigers, gorillas, and deer. Some animals have also been affected by the loss of habitat or food sources due to human activities or lockdown measures. For example, some monkeys in Thailand have become more aggressive due to the lack of tourists who used to feed them. On the other hand, some animals have benefited from the reduced human presence or interference in their natural environment. For example, some endangered species have shown signs of recovery or increased reproduction due to less poaching or hunting. The pandemic has also had mixed effects on the environment. On one hand, it has reduced greenhouse gas emissions and air pollution due to less travel and industrial activity. On the other hand, it has increased waste generation and plastic pollution due to more use of disposable masks and gloves. Finally, let's talk about what we can learn from COVID-19 for the future. One of the main lessons is that we need to improve our preparedness and response to emerging infectious diseases. This means strengthening our surveillance and early warning systems, enhancing our diagnostic and testing capacities, developing rapid and flexible vaccine platforms, ensuring adequate supplies of personal protective equipment and medical devices, investing in research and innovation, building resilient health systems, training and protecting health workers, promoting public health measures, engaging communities, and coordinating actions at local, national, and international levels. Another lesson is that we need to address the root causes of pandemics, human activities that disrupt nature and increase the risk of spillover events. This means reducing deforestation and habitat loss, preventing illegal wildlife trade and consumption, promoting sustainable agriculture and food systems, conserving biodiversity and ecosystems, mitigating climate change and its impacts, enforcing environmental laws and regulations, raising awareness and education, and fostering a One Health approach that recognizes the interconnection between human, animal, and environmental health. These are some of the main things that we learned from COVID-19, a disease that has challenged us in many ways, but also inspired us to find solutions and work together. We hope that this episode has given you some insights and perspectives on the pandemic, and that you will continue to follow the latest scientific developments and recommendations to protect yourself and others from COVID-19. That's all for today's episode. Thank you for watching Curiosity. If you enjoyed this video, please like and subscribe for more content like this. And don't forget to share your thoughts and questions in the comments below. Until next time, stay curious.